In recent years, possibly due to the rise in obesity, the prevalence of diabetes worldwide has made it one of the most common chronic medical diseases. Diabetes mellitus encompasses a group of disorders where individuals suffer from having too much sugar, also known as glucose, in their blood. Glucose has several important roles in the body. Most importantly, it serves as a fuel source for the brain to function properly. It also provides energy to the muscle and tissue cells in the body. Although sufficient amounts of glucose are required for an individual to be healthy, excess amounts in the blood can lead to immediate health problems associated with fatigue. Excessive or high blood glucose levels over an extended time can lead to serious health issues such as damage to the eyes, kidneys, nerves, and the heart. The underlying causes responsible for the excess of glucose are used to differentiate between the types of diabetes. The two most common types of diabetes are type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 diabetes mellitus. Although it was previously known as juvenile diabetes due to the high diagnosis rates in children, type 1 diabetes is not limited as a childhood disease. It can affect individuals of any age, race, or body type. In healthy individuals, the body breaks down carbohydrates that have been eaten into sugars in the blood, also known as glucose. The body then uses this glucose for energy. Insulin, which is produced by the pancreas, is the hormone that the body uses to move the glucose from the bloodstream into the body cells. In the case of type 1 diabetes, an individual's cells that are responsible for destroying invading cells that can cause infection or illness start attacking and destroying healthy cells in the pancreas that produce insulin. This is considered an autoimmune response, meaning the individual cells are attacking other cells in their body. Depending on the amount of destruction of these cells, the pancreas is either unable to produce insulin at all or is unable to produce sufficient amounts needed to remove the glucose from the bloodstream. The result is an increase in blood sugar levels. Type 1 diabetes makes up 5 to 10% of all cases of diabetes. The risk factors for this type of diabetes are somewhat unknown, but lifestyle and diet are not considered risk factors for type 1. Family history does seem to play a role in increasing the risk. It is also believed that parents can pass certain genes on to their children that can put them at risk. Exposure to certain environmental triggers, such as viruses, can cause those genes to become activated and initiate the autoimmune response against the insulin-producing cells of the pancreas. Treatment with insulin replacement therapy can help individuals with type 1 diabetes live relatively long and healthy lives. Type 2 diabetes mellitus. Type 2 diabetes is also known as adult onset diabetes, since the majority of cases are diagnosed in adults. In this form of diabetes, although the pancreas is able to produce insulin, the body is unable to use it properly for moving the glucose from the bloodstream into the cells. This is also known as insulin resistance, because the body is essentially resisting the insulin that is available. In the beginning, the body recognizes that the insulin is not working properly to transfer the glucose, and it stimulates the pancreas to make more insulin in an attempt to lower blood glucose levels. Over time, the pancreas is unable to keep up with the production demands. Type 2 is the most common form of the disease, making up approximately 90% of all cases of diabetes. Although there is a family history aspect involved, risk factors for this type of the disease focus more on lifestyle and diet habits. The majority of individuals with type 2 diabetes are overweight or obese. Other individuals at risk include those with apple-shaped body types that store fat predominantly in the abdomen, and those who do not engage in routine physical exercise. Ingesting large amounts of foods high in carbohydrates without the energy needs required from physical exercise can lead to excess sugars in the blood from the breakdown of ingested carbohydrates. The body's inability to utilize available insulin to remove the sugars from the bloodstream lead to excess blood glucose levels. People of Black, Hispanic, American Indian, and Asian American races are more likely than other races to develop this form of the disease. Gestational diabetes. Gestational diabetes is a form of the disease that is seen in pregnancy, typically after 20 weeks of gestation. During pregnancy, the placenta produces large amounts of hormones. Many of these placental hormones interfere with the actions of insulin, causing increased blood sugar levels. These high levels can affect the growth of the baby, often resulting in high birth weights. High birth weights can lead to complications during delivery that could require a cesarean section. High blood sugars can also lead to premature labor and deliveries before the infant's due date. Premature infants often experience respiratory insufficiencies, requiring assistance breathing until their lungs are mature. If untreated, gestational diabetes can lead to infant death before or shortly after birth. Although any pregnant woman has the potential to develop gestational diabetes with each pregnancy, some are at greater risk. As seen in type 2 diabetes, individuals who are overweight or obese, have a family history of diabetes or a personal history of prediabetes, or those who are of Black, Hispanic, American Indian, or Asian races have a greater risk of developing this form of the disease. The risk of developing type 2 diabetes in the future is increased with mothers and infants affected by gestational diabetes. Healthy diets, weight loss, and physical exercise can reduce the risk of the disease. Shortly after delivery of the placenta, blood sugar levels return to normal. Prediabetes. In prediabetes, individuals experience high blood sugar levels, but the levels are not high enough to be considered type 2 diabetics. Many people do not even realize that they have prediabetes because there are often no symptoms. According to the Centers for Disease Control and Prevention, at least 1 out of every 3 American adults, approximately 84 million, have prediabetes. Without lifestyle modifications, prediabetes increases the risk of developing type 2 diabetes, heart disease, and stroke. Positive diet, exercise, and lifestyle changes can eliminate prediabetes.
Hypoglycemia, or low blood sugar levels, is defined by a plasma glucose level of 70 milligrams per deciliter. Due to the complexities of the human metabolism and how sensitive each person's body responds to separate blood sugar levels, not everyone will experience a hypoglycemic reaction at the same blood glucose level. In other words, person A may experience signs and symptoms of having a low blood sugar level at a plasma level of 92, when person B may not experience symptoms until their plasma levels reach concentrations of 60. Due to this wide variance, the American Diabetes Association Workgroup on Hypoglycemia has recommended the 5 different classifications for hypoglycemia. Class 1 is called severe hypoglycemia and requires a second-party intervention to raise blood sugar levels. This example includes circumstances where an individual would be in a coma-like state, are severely confused, or cannot easily replace their own blood sugar levels. The person helping with the intervention usually helps the primary person with oral interventions such as orange juice, graham crackers, and peanut butter, or may even need to help raise the blood sugar levels with a glucose syringe. Class 2 is called confirmed hypoglycemia. Blood glucose levels are less than or equal to 70 milligrams per deciliter as confirmed by lab work or a glucometer, but the second party intervention isn't necessary. The individual experiencing the symptoms is able to recover from their own signs and symptoms through oral intake of sugar. Class 3. This is called asymptomatic. The blood glucose levels are at 70 milligrams per deciliter, and the individual meets the clinical definition of hypoglycemia, but no physical signs or symptoms of hypoglycemia have occurred. This usually occurs when an individual's metabolism has acclimated to low blood sugar levels. Even though someone may not be symptomatic, it's recommended that plasma levels of 70 be supplemented with oral glucose. This is to ensure that blood sugar levels do not continue to drop to dangerous levels. Class 4. Probable symptomatic hypoglycemia. This is when an individual reports feeling symptoms of hypoglycemia, but blood work has not yet been obtained to reflect the symptoms. In other words, An individual is reporting the symptoms of feeling symptomatic, and they were treated in order to help them return to a baseline, but there was no blood work collected to ensure that they were in fact below a concentration level of 70 milligrams per deciliter. Class 5 is called pseudohypoglycemia. Typical symptoms of hypoglycemia are reported by the patient. However, blood work presents a plasma level greater than 70 milligrams per deciliter. This typically means that the individual's metabolism has adapted to higher blood sugar levels. Treatment should be applied to prevent the patient's symptoms and in order to keep them comfortable. Signs and symptoms are often used interchangeably. From the experiences of this nursing team, the words signs are used to describe what an onlooker or an observer can witness when they look at an individual. In this case, when someone who is experiencing low blood sugar levels, a doctor, nurse, or family member may see tremors or shaking of the hands or feet. They may see diaphoresis or heavy sweating on the forehead, extremities, and core of the body, so much so where their clothes and sheets may even be wet due to the sweat. They may experience unusual behavior, exhaustion, tiredness, lethargy, like falling asleep in mid-sentence, may be a sign of low blood sugar levels as well. In extreme cases, comas may occur. Because our brains are dependent heavily on blood sugar levels, cognitive functions may become impaired, leading to confusion, memory loss, and unusual speech patterns. Symptoms are those experiences felt by an individual which cannot be seen by an onlooker. Symptoms of hypoglycemia include anxiety, paresthesia, or a temporary sensation of pins and needles in the arms and legs, which will improve after blood sugar levels are treated, heart palpitations, or a feeling that the heart is skipping a beat, beating too hard, or fluttering, and hunger. These symptoms are described as subjective symptoms and should be taken seriously by any clinician. Much like hypoglycemia has a clinical definition, hyperglycemia, or high blood sugar levels, also has a clinical definition. An elevated blood sugar level after fasting, or no food or water for 8 hours, is a plasma glucose level greater than 126. This represents an at-risk for type 2 diabetes. A more accurate representation for a true diabetes diagnosis would be a hemoglobin A1C of greater than 6.5%. This test measures the average coating of sugar on hemoglobin proteins. Since hemoglobin proteins are carried by red blood cells, which live about 3 months, the test is an average of glucose control for the past 3 months. An A1C greater than 6.5% is a strong indication of poorly controlled blood sugar levels. Hyperglycemia generally remains asymptomatic over years due to its slow buildup. It causes no overt symptoms, and because of this, many people are unaware of its dangers until chronic or long-term damage occurs. On the occasion that rapid onset of hyperglycemia does occur, it's usually related to type 1 diabetes rather than type 2. Signs and symptoms of rapid onset hyperglycemia include frequent urination due to the body's attempt to dump the high blood sugar content, frequent thirst due to the frequent urination, and frequent hunger related to weight loss. Signs and symptoms of prolonged hyperglycemia include frequent infections, poor circulation, and neuropathy. High blood sugar levels introduce opportunistic infections. Foreign bacteria love dark, damp, sugary environments. Common infections include skin infections, genitalia infections, urinary tract infections, and oral and tooth infections. High blood sugar levels damage blood vessels, which decreases blood circulation availability, particularly those which have to travel against gravity, like those in the feet and legs. Compounding the circulation difficulty is also the risk for neuropathy, where the decreased blood flow also decreases the flow of nutrients to the surrounding nerves, creating chronic nerve damage.
At this point in the presentation, we'd like to present some of the long-term complications that can come as a result of having diabetes. Diabetes is a disease of having high levels of sugar in the blood, and having these high levels of sugar in the blood over the long term causes damage to both the large and the small blood vessels in our body. So the areas that are most affected are those that are highly vascular, and when it's large blood vessels, that can lead to cardiac disease such as heart attack. High blood pressure is another increased risk for heart disease. It creates also damage to the blood vessels, and that is what can lead to chest pain and heart attack. When you have damage to the small blood vessels in the brain, that can lead to stroke. And so since the brain has a lot of these little tiny blood vessels, if they are damaged or if a clot develops, that is what can lead to stroke. The signs and symptoms of cardiac disease are chest discomfort, pain, and that can be in your arms, your back, your neck, your jaw, your stomach. You might have shortness of breath, cold sweats, nausea, or lightheadedness. All of those would be an emergent situation, which means call 911 or get straight to the nearest emergency room if you have any of these symptoms. Symptoms of stroke can be sometimes facial drooping. One side of the face looks different than the other, arm weakness on one or both sides, and difficulty with speech, either not being able to form words, things like that. Again, those are emergent symptoms, which mean you need to call 911 or get straight to the nearest emergency room. The way to prevent these long-term complications are to control your blood sugar on a daily basis. Work with your physician on what medications you should use to keep your blood sugar in a normal range, and also control your diet so that your blood sugar is where it needs to be. These are things that will not happen right away, but over time the damage occurs and it can lead to these serious complications. Another area of the body that is highly vascular, which means lots and lots of blood vessels, is the retina or the eye. Chronic high blood pressure and high blood sugar cause damage to these small blood vessels of your eye when you're a diabetic. This doesn't happen again overnight. These are long-term complications, and so chronically high blood sugar will over time cause damage. And the damage that's caused to the retinal vessels is permanent. It cannot be reversed once it happens, and it can lead to blindness. High blood pressure can make these symptoms worse. So the most important thing that you can do as a diabetic if you want to prevent this long-term complication is to see your eye doctor every year. They will do a special diabetic eye exam to check these retinal vessels to make sure that there is no damage occurring. The other thing, as in all of these long-term complications that you can do to prevent the complications, is to control your blood sugar, control your blood pressure, keep it within a normal range with your medications, your diet, and exercise so that you can prevent this from happening. The good news about retinopathy or disease of the eye is that fewer people with diabetes are actually developing blindness because they have improved the technology for screening for retinopathy. So if you're going to see your eye doctor, they will be able to screen and make sure that this damage is not occurring, or if it is, to catch it early and determine how to treat it. Kidney failure and kidney disease is another long-term complication of diabetes. Diabetic neuropathy is actually the most common cause of renal or kidney failure in the United States. And this is because this chronic high blood sugar causes damage to the small blood vessels of the kidney. This leads to chronic kidney disease, which is also sometimes called CKD. It has 5 different stages, and then leads to end-stage renal disease. Once a person with diabetes or anyone who has end-stage renal disease, once they get to that point, it might be necessary to go on a special treatment called dialysis. This is a treatment where usually you go into a facility maybe 3 times a week where you sit down and a special machine works to kind of clean out your blood because your kidneys cannot do that process anymore effectively. The other treatment for this can be a kidney transplant. Now, kidney failure, it's not obviously symptomatic. So in day-to-day life, it might not be something that you know you have. So it's important to have your screening labs done by your physician because this condition is diagnosed by blood and also urine tests. They're checking for high protein levels, which means that your kidneys are not functioning well. As in the other long-term complications, the way to prevent this long-term complication is the same. It's very important to control your day-to-day blood sugar and your blood pressure. Also, it's important to be aware that heart disease and kidney disease are closely linked. So if you have one, it might be likely that you would have the other. So continue to see your physician, continue to check these tests and these different screening and diagnostic things that can be done. Just stay on top of it. Make sure that you're constantly checking on a regular basis and that you're following the guidelines put in place, because these symptoms, as I said, won't show up immediately. They won't be very obvious, but it will happen over time if blood sugar is not well controlled. Neuropathy and foot disease might be the long-term complication that you are most familiar with when we're talking about diabetes. The nerves and the blood vessels in the hands and the feet are highly susceptible to the damage that high blood sugar causes. It can damage the nerves and cause numbness, tingling, sometimes a burning pain. It can also cause sensitivity and cold feet. Because of this damage that happens to this part of the body, it makes it very hard for the body to fight infection or heal from injuries that happen to that part of the body. That's why it's so important as a diabetic to make sure that you're checking and taking very good care of your feet. It's important to check your feet daily to see if there's any areas of redness, any sores, any injuries. Because diabetes can damage the nerve endings there, you might not be able to feel an injury or a sore that you have there. So it's really important to visually inspect your feet. And if you can't physically inspect your feet, have someone that you know check your feet for you. It's also very important to prevent any type of injury, and you can do that by wearing shoes all the time in the house. Don't go around barefoot when you might have a potential for having an injury there. Because the body cannot heal injuries that happen to your feet, if it happens, it can be a risk for infection as the injury progresses. It can also delay healing, so it means that the wound will stay open and it won't heal, and if it gets bad enough, it can lead to amputation. If that wound cannot be healed successfully, it might be necessary to amputate a toe. Some people have to have their foot amputated, or sometimes even higher up, like below the knee. These are serious complications, obviously, and they can happen. And so it's so important to be checking your feet. Sometimes you might notice when you go to the doctor as a diabetic, the doctor will have you take off your shoes and socks, and it will check. The physician will check using this special tool called a monofilament, and this will be able to you'll be able to tell the doctor whether you can feel in different areas of your foot, and this will be able to gauge how much damage the long-term diabetes is causing to your feet. Now, this complication is something that you might notice the symptoms of. It's not usually right away for newly diagnosed diabetics, but it does happen over time to many, many diabetics that you will notice the neuropathy. And that's that burning pain or sometimes the cold feet. So it's just very important that we're always checking and taking good care of our feet as diabetics, and just watching out so that we can prevent any of the serious complications such as amputation.
In this part of the presentation, we are going to talk about the treatment of diabetes. As we have previously learned, diabetes can present in different stages depending on the severity of the situation. The most typical issues, the most typical problems we get to see as nurses is when a patient presents with signs and symptoms of excessive thirst, excessive urination, or a shock if the glucose levels are too low. It is important for the patient to understand and to recognize that no symptoms are the same for every patient, and they need to learn how to recognize what are their individual symptoms. Treatment will be based and done according to what they present. For example, if they're presenting with low sugar, the immediate treatment will be to elevate those sugar levels. If they present with elevated blood sugar levels, and the treatment would be to start fluids and medication. If they're presenting with heart attack or stroke, then the treatment will be to treat the heart attack and or the stroke. Again, treatment is depending and based on the symptoms that the patient presents with. As previously mentioned, at the emergency department, the first treatment that is done is we start accessing the patient intravenous system, that is to have a quicker access to their system, and we immediately start loading the patient with fluids. Since this diabetes can cause severe dehydration and hence causing the accumulation of sugars, it is important to replace those fluids immediately. That will be followed by insulin medication depending on the levels of the patient, and also to manage the symptoms as previously mentioned. Some of the symptoms can present as again, heart attack, stroke, or even neuropathy, something that many patients do not realize how dangerous this can be. Patients do not understand that this is part of their illness, this is part of the diabetes, and sometimes because of the lack of feeling or sensitivity in their feet or their arms, they just simply ignore the pain by the time they get to or seek treatment with a medical professional. It can be too late. Patients need to understand and be fully aware of these situations, of the dangers that this can cause to their bodies. In reality, the best way to treat diabetes is for every single patient to follow the orders, the regime that the doctor have put them on, whether it is to control the diet, to watch the amount of sugars that they consume, or to control their glucose levels by checking their sugar 2-3 times a day, depending on the severity of their cases, or by exercising and losing weight. It is important for a patient to follow the instructions as given and not to make any changes without proper consultation with their physicians or with their private care provider. By doing this, diabetes can be prevented and can be treated at home without having to experience the severe pain or the financial struggle that this can bring as if someone gets into an emergency department. A simple visitation because of diabetes that was not properly treated can bring severe ramifications to the family, whether it's financial or physical or even mentally. It can bring a stress to the patient, which is not good for their health. It can bring a stress to their family, and it can bring even a more chronic issue if not treating their diabetes accordingly. Patients, please follow up with your doctors. do not ignore the instructions given. They are given to you for a reason. It is not easy to treat the diabetes once it gets out of control. It is not a simple shot or a simple pill that can be given and it will fix the situation. It has to be done. It has to be quick, and so we can prevent severe cases of a stroke, heart attack, or even death, depending on the severity of the situation.